Good afternoon, everyone. Welcome to the Johns Hopkins School of Education Counseling Student Panel Virtual Webinar. My name is Tyrene Maddox, and I am the Admissions Coordinator at the Johns Hopkins School of Education. Also presenting today, I have my colleague from the Office of Admissions, Sion Jung, and she will introduce herself.
Hi, everyone. My name is Sion Jung, Assistant Director of Admissions here at the Johns Hopkins School of Education. Thank you for joining us today.
Also, we have a faculty member from the counseling department, Dr. Justin Lauka, and 4 panelists. And we'll introduce the panelists in the next few slides. But before we get started, I would like to cover a few housekeeping topics. First, today's webinar is being recorded. We will be able to share a link with you after the event is complete. Also, please take a second to see if your mic is on mute and your video is off. There will be a Q&A session at the end of the presentation. At that time, we ask that you type your question in the chat box and we will read and answer your questions accordingly. Next, I would like to share the agenda for today's presentation. We will go over introductions, and then Dr. Lauka will facilitate the student panel. And lastly, we will open up the floor for questions. So moving on to faculty introductions, Dr. Lauka is an assistant professor in our counseling department. He joined faculty in 2019 and has a PhD from Old Dominion University. His research focuses on counseling supervision, clinical training, and professional educational standards. His prior experience, he was a program director for a CACREP accredited clinical mental health counseling program. And now our panelists. So our first student panelist is Ayesha Tibrawala. She is currently in the Master of Science in Counseling Clinical Mental Health program. She attended Women's Christian College in India and received a Bachelor of Science in Psychology. And her professional experience includes counseling intern at SciMed Hospital in India. Next, we have Jin Zhang. Her graduation year was 2021, and she received her Master of Science in Counseling Clinical Mental Health. Third Military Medical University, where she received a Master of Science in Applied Psychology. And her professional experience includes clinical research assistant of a medical university in China. Next, we have Nikki Caldwell. She is a current student here at the Johns Hopkins School of Education within our clinical mental health counseling program. She received her bachelor's degree of Bachelor of Science in Health and Exercise Science, minor in psychology from Wake Forest University. And her professional experience includes diversity inclusion professional, and she was also a former AmeriCorps member. Last, we have Aisha Mason. She's a current student, and she's currently in our clinical mental health counseling program. Her bachelor's degree was received in business administration with a concentration in information systems from Catawba College. Her professional experience includes Director of Diversity, Equity, and Inclusion, St. Paul School for Girls, middle and upper school educator. And now I will hand it over to Dr. Lauka.
Thank you very much, and thank you all for being here and for your interest in the program. And of course, I want to say again, thank you to the student panel members for being willing to take time out of your busy schedules to be here. You know, when thinking about the range of questions, and we look forward to the answering the range of questions you all have after this. But for the panel, I'm going to start with just a very broad question chronologically. When thinking about your time leading up to the program, and what appealed to you about the counseling program at Johns Hopkins? What really drew you here? And anyone can answer in any order that they like.
Sure, I can get us started. This is Nikki Caldwell speaking. It's nice to meet you all. So in terms of what drew me to the program at Hopkins, diversity and inclusion was absolutely at the top of my list of things I was looking for. I wanted a program that was well-rounded in terms of cultural competence. Representation was really important to me. So one of the first things I did during my search was I went to the website and looked at the faculty, and I was very pleased with the representation that I saw the counseling program had here in person. settings the best. And so I was really looking for, and a program that would allow me to be face-to-face with classmates, be face-to-face with clients and professors. Of course, that was, the pandemic has shifted many things. And so learning to interact virtually is definitely something that I've gained in the last year and a half of being in the program. But I certainly was looking for that in-person component as opposed to, the number of online programs that are offered these days.
Hi, it's Aisha Mason. Nice to meet everyone. I'll just piggyback off Nikki. Exactly two of the things she said I completely agree with and looked for as well, as far as diversity, equity, and inclusion, the cultural competence piece, and the in-person aspect as well. Additionally, I looked for a flexible class schedule. So I'm working full time. So in addition to in-person classes that will be offered in early afternoon to evening, where I would be able to get there and learn in person, but something that also went with my schedule.
Just I completely resonate with what Nikki and Aisha just mentioned, and I completely agree how diversity was one of the major factors that drew me towards this course at Johns Hopkins. And a couple of other factors that really drew me towards this course was the faculty. I saw that there was a diverse range of faculty who had research interests similar to mine. So knowing that working closely with them and learning from them would be very enriching for me from a personal point of view and a professional point of view. So knowing that there are faculty members who I can work closely with, who match my research interests, was a major factor for me. And apart from that, as an international student, I saw that a lot of the students here are also international students. So I wanted that as well for my growth and personal learning, because being around minds from different parts of the world was really important for my growth as a counselor and to feel more included in a more inclusive space. So those are a couple of factors that really drew me towards this program.
Yeah, this is Jane. I agree with you, and also to these programs, I think diversity is the biggest reasons I concerned first. Our faculties and students come from different cultural backgrounds and identities, and I can learn in a multicultural environment. That means a lot to me. And also, I think Hopkins Network may have more chances to reach out other professionals in mental health areas and creating learning opportunities and job positions in the future. So that's why I think it is a good choice for me. Thank you.
Thank you all. It's always great to hear a saturation of themes that arise, as well as unique aspects of what drew y'all here. Certainly, it's nice to hear that our program mission at least comes through on paper in the website. That certainly the composition of the faculty, are the programmatic values of diversity and inclusion and social justice. At least that is presented here, and that as we'll go on further, hopefully that is also shown out in different aspects once upon admission in here. But thank you. So the next question that I would want to follow up with, as all of you are at different points in the program, and perhaps I probably should have asked that question as well, and maybe you all can share that to your level of comfort. But when you're thinking about your experience up until now, what skills or knowledge have you learned throughout the program that you found most useful, most applicable? Yeah, I'll leave it there.
This is Aisha. I can start with this one. Again, I'm still working full time, and I currently work in an educational setting. So it's a middle and a high school. So something that, and I'm currently still in the program, and I'm on the school counseling track. So specifically, the things that have been most applicable to my current situation are the stages of development, different counseling techniques, and the counseling adolescence course. I mean, they've all been amazing, but to what applies specifically to what I'm doing now. And I'm not counseling right now. obviously, because I'm still in the course. However, just understanding the techniques helps in working with adolescents and listening and just kind of processing their thoughts, feelings, and emotions in a different way with the knowledge that I've gained so far in the courses.
Thanks.
This is Ayushi, and I agree with Aisha again. Also, what I really consider valuable is the all the lab courses that I've been part of, like counseling techniques, diversity, and social justice. All these lab courses have practical components such as mock counseling sessions, as well as CBT, which I think have been really helpful for me to not only see my growth as a counselor, but also as a human being, as someone who's learning, as someone who interacts with people on a daily basis. So I think it's helped with a lot of my personal skills as well as professional skills, because the knowledge that I could be gaining knowledge from a lot of different mediums and components and courses, but to be able to learn the practical tools to not only communicate with the client, but also be a counselor and learn those skills in a learning space within your peers and faculty supervising you. I think those are very valuable skills that I have been able to inculcate.
Thank you, Ayushi, also for bringing up the lab courses. One thing, I think this is something that really differs in our program compared to other counseling programs in the extent of the amount of lab-based courses. I've worked in several KCREP accredited programs. All of them have some form of lab courses, but the number of courses and how we infuse that in the curriculum in terms of the diversity, social justice being a lab course, that is not typically how it's administered. Oftentimes it's more of a lecture or just group process oriented, but I think you're bringing up the clinical focused and the experiential nature of how the curriculum is tailored. Thanks.
Yeah, I can follow that. So I think for me, what's been most useful is the foundational knowledge that I've developed. As you saw in the introduction, I majored in health and exercise science and I minored in psychology. And so by the time I left undergrad, I knew that I was interested in how the mind works. I knew I was interested in working with people. But I came into this program sort of feeling like there was much more for me to explore and establish in terms of my understanding of mental health. And so I came in really seeking just that foundational knowledge. I wanted to sort of formalize my concern for, being a listening ear and helping people navigate life challenges by receiving a formal education in mental health or counseling. And so I absolutely feel like I am receiving that in the program. Some of the first courses that I took and likely prospective students will take as well include Introduction to Clinical Mental Health Counseling, Human Development, Counseling Techniques, which is that lab course that Ayushi mentioned, where first semester, you're going to be practicing the everyday skills that a counselor would. So if you're wondering sort of how does a therapist do what a therapist does, you're going to get that question answered pretty much immediately. And then also counseling theory. So learning how to conceptualize and make sense of the experiences and the narratives that your clients are coming to you with. And so I think for me, that's what's been most valuable, is sort of almost being able to organize information and organize experiences into sort of these broader concepts, be that technique, be that theory, be that diagnoses or psychopathology, be that career counseling, or even diversity. That's sort of what I think has been most valuable for me so far.
Thank you, Nikki. I think one of the things that aspects of what you've shared is a really enlightening part of the course structuring and the scaffolding that occurs, or that ideally occurs in terms of creating this foundation and base and meaningfully established courses so that you can learn but are not overwhelmed by the entire scope of the endeavor of becoming into a professional counselor. And so it sounds like the way that so far it's been structured and broken up has been useful and manageable.
Absolutely.
Thank you.
And actually, I agree with all of you. And I think in this program, in the training process, I gain like multicultural perspective. I think specifically, I learn a lot from my peers and faculties, communicate with them can broaden your horizon about like different like cultural perspective. And also in a counseling technique course, we learn a skill named broaching. I think that's a very, very useful techniques for me, and especially as an international student. That's facilitates my awareness and exploration of race and other cultural factors related clients' issues when I was doing my internship. Also, I think some of my course have many self-reflection papers, which can also help us gain more self-awareness as a cultural being, also a counselor in training. So.
Thank you, Jen. You know, one of the things also you just talked about with the whole concept of broaching, which for those of you who are not aware, the developer and originator of the process of broaching diversity in the counseling session, Dr. Norma Devines is a faculty here and is associate dean. So it's no wonder that comes through in various ways in the program. At least, hopefully, it should stand out. It's certainly as a faculty member, knowing that Dr. Norma Devines is a faculty here was a large draw for me in looking for the next institution where I would be working at. So that's thank you for that, adding that contextual layer.
Thank you.
And just to quickly share with those listening who may not be familiar with the term broaching, broaching is essentially behavior that shows the therapist opening communication, opening dialogue for the client to discuss aspects of their identity related to race, ethnicity, and culture. So it's the therapist making room for and actually inviting and initiating conversation about the client's experience related to these various aspects of identity that oftentimes, can be taboo. A client may not feel like they're allowed to speak about their sexual identity or the racial injustice that they've experienced. And so the concept of broaching, as Dr. Lauka was speaking about, originated with Dr. Norma Devines, who is faculty here at Hopkins, and is really about making the counseling space or the counseling relationship one of honest, authentic, transparent dialogue about the client's full identity.
Well stated. Well stated. And certainly the counseling literature is pointing towards more and more outcome research has shown that broaching and engaging in those difficult dialogues and inviting that space are actually indicative of positive client outcomes, and certainly the contrary of not engaging, not inviting, and broaching is often lead to poor therapeutic outcomes and high attrition and turnover. So thanks. So I think I'm going to shift gears a little bit and ask if any of y'all would like to speak about your experiences in terms of support or interactions with faculty, be it advisors or mentors. Can you talk a little more about the support you received from faculty in those roles?
This is Aisha. I received a tremendous amount of support. As I mentioned before, I am working full-time and coming back into school after being out. I graduated undergrad in 2003. So I was definitely nervous about returning to school. Again, one of the reasons why I preferred in person. But I think my advisor and faculty members have been extremely supportive. If there was a concern that I had or an issue, whether it be personal or educational, they always have office hours or provide contact information to reach out. I kind of always joked, is it just because I'm in counseling that everyone's so nice and understanding? But the professors definitely, as we all mentioned, come from different cultural backgrounds and not only teach about cultural competence, but uphold it. So it feels like a very comfortable and welcoming environment. With that, though, they also kind of push us to be our best selves. And so if, the lines of communication are open, and for example, if a deadline can't necessarily be moved, they don't really make you feel bad about it. It's just extremely supportive and understanding, yet there's that gentle nudge to kind of perform our best and be the best that we can.
Thank you, Aisha. You've talked a little bit about this idea of holding the tensions between challenge with support, and it seems like, at least in some of the experiences you've had, you had faculty that do a nice job at the same time creating a supportive environment, yet holding you to the high standards that we expect of our students.
Exactly.
Thanks.
And I think I can relate to Aisha because actually as an international student, we have more like barriers and challenges here. But for them, our advisors can provide effective advice about your academic study. And also if you have personal issues and concerns, you can also reach out to them. And like another faculties, when I entered the practicum internship, I think school supervisor also helped me a lot in my like field experience. Also kind of you can also get like other informations and help from our group leaders or other kind of we say like me, we can get some support from Chinese professors here. So I think that's super helpful.
Thank you.
My experiences with support have been very pleasant as well, especially in terms of like it's mentioned, as an international student in the first year of my program, it was all online. And I was doing it back from India, where it was definitely very isolating with the time difference and everything. In terms of that, I think I was very, very pleased with the support I got from the faculty and my advisor, because I could reach out to them knowing that they'd understand my struggles and know that isn't just about deadlines, or it isn't just about how well I'm performing in class, but also with the mental stress and the struggles of doing this in a pandemic. They always went and took the extra effort to make us feel like, or at least make me feel like, I'm not doing this alone, and make the experience less isolating in that context. So I was always grateful about that. And now being here in person, I know I have relationships with faculty members where I can really just shoot them an email and know that they're going to get back to me within the 24 hours. And if they don't, then it's just they're busy, or like I just know that they would do their best to get back to me and be there and be very responsive. And even with my advisor, I've been in touch with my advisor, and I've never had any difficulties getting the support I need.
Well, as your advisor, Ayushi, I'm glad to hear that. The feedback's appreciated. So I'm wondering if any of you all could share, we've talked a lot throughout about different aspects of the curriculum and what drew you, and the diversity elements and broaching. Is there anything else in terms of your coursework and experiences that have been really foundational for you all in terms of diversity, inclusion, and cultural competence that you've received in different courses that stand out to you all?
Sure. So as it's been said, diversity, cultural competence, multiculturalism is certainly a prominent aspect of what's on the website. And I feel like that has also been incorporated into each of the courses. Pretty much all of the courses incorporate some consideration for the culture of the client and not only the client, but of yourself as a therapist. Particularly in the first year, students do a lot of self-reflection. A lot of the papers are around your own identity and your own experience to make sure that you have that sense of awareness coming in to the program. I remember when I was I think I was interviewing. So I was a prospective student in the counseling program here. And one of the faculty members told me essentially that I was sure to get a diversity of perspectives and experiences. And that has absolutely held true since I've been in the program, not only with, the racial and ethnic diversity, but also, the number of international students here in the program as well. And I think that's something that I have learned and I'm still learning. Diversity, equity, and inclusion, striving to be culturally competent, that is an ongoing journey. It's not an end goal, but it's something you're constantly working on. Even with, for me, a prior career in diversity and inclusion, there are still things that I can continuously do better and learn about. And so I think that for me in the program, I will say that I have been challenged to work with such a diverse population. And I think that's something that maybe is less emphasized. Diversity, frankly, is so important, but is not human nature. Like we oftentimes associate and seek people who are like us. And so it really does take a certain level of intentionality and challenge sometimes to interact with people who are different from us and to actually benefit and embrace the difference that we all share. And so I can speak for myself in saying that I have experienced, the necessary challenge of learning to consider different perspectives or perspectives that I wouldn't have considered on my own, or different cultures. Students even have different ways of interacting in the classroom. Some students are quick to answer the question. Some students are more hesitant and really only speak when they're directly, spoken to. And so what does that do to the class environment? What does that do to the learning process? You have to be able to embrace all of that. So I think that has been part of my journey and experience here at Hopkins in terms of a program that is so beautifully diverse, is really learning that inclusion and even that equity component with it.
Thank you, Nikki. It certainly is one thing to put on the banner of diversity, inclusion, social justice on the website in our program objectives and mission, but ideally we want to see it being lived out, to being seen it actually implemented and seeing where it shows up in the counseling spaces, in the classrooms, and interactions with faculty. And you also made a really great point just about this. It seems to me that some of with counseling and with our growth and development, a lot of these things don't come natural to us, and there are certain things that we have to unlearn in addition to learning. And that requires, as you had said, openness, vulnerability, willingness to challenge our assumptions. So thank you.
Absolutely.
If no one else would like to speak to that particular question, we can move on. I've got several more. Let's see, could you all talk a little bit, about any particular assignments that may be unique or novel to the counseling program here. For example, somebody had mentioned emphasis on reflection, self-reflection assignments. Anything else stands out to you in terms of the types of assignments?
This is Aisha. Within the counseling program, there are We have to do a lot of recordings with each other, so pair recordings or group recordings, and to help with what our counseling skills, or in the CBT class, it was took it as a lab, and also within that class, there's a lot of recordings, so we can really evaluate, self-evaluate, peer-to-peer evaluation, and also our professors evaluate the skills and the theories and things that we've learned. So just for me personally, being a little bit more shy, that was something to get used to, is to have to record myself and then to get that feedback from your peer and also from your teacher. And that could be a little uncomfortable sometimes, but it's definitely for our benefit. And after a while, it gets, well, it's a little nerve wracking, but you understand what the benefit is, and it really is a good tool for the future. And speaking to the diversity piece, there's a lot of group work or partner work in and out of the classroom. So that's something that kind of challenges you, as Nikki mentioned earlier, to really get to know others, your cultural competency, because our campus and our classrooms are so diverse. And again, someone who's actually a little bit more shy, it may be uncomfortable at first, but it really is extremely helpful. So that's what I would say.
Thank you, Aisha. It certainly, I think you're speaking a little bit to a lot of the risk taking and vulnerability and challenge that shows up in these courses that perhaps may not may differ in perhaps traditional typical lecture based format programs. So thanks. Anyone else?
This is Ayushi. Yeah, I'd like to mention some of my favorite assignments through the program were typically those that you can sort of work on all semester. For example, like in the human development course, we did the Mosaic project, which is like self-reflecting on all your childhood experiences and then adulthood experiences. So through your lifespan development, talking about your just self-reflecting on your experiences and applying that to the theory that you're learning, or trying to pen down your approach towards your theoretical orientation and counseling, or even the group proposal that we worked on for the group counseling classes, where you sort of work on a proposal for a group that you're going to design throughout the semester. So I think these assignments were very unique and really got me thinking and engaged throughout the semester, where I could really work on it a little bit every day, a little bit with every passing month. I could build on it and get feedback from faculty. So I think that was really good, because it wasn't just a deadline that you had to meet. It's something that you work on consistently and keep getting feedback if you'd like. And towards the end, you have something concrete that you can really use as a counselor in your professional work. So those were some assignments that were really valuable.
Thank you, Ayushi. You know, there are a few things that just really stand out about this. You know, the type of assignments that, at least the ones you mentioned, you have the option and the opportunity to receive ongoing feedback throughout. It's not just a one assignment at the end of the semester and good luck, but it all builds up to it, and there are opportunities, and even within that one class, to be able to get feedback, to make improvement, to work up or lead towards this final product that is meaningful and has applicability to what you'll all be doing as counselors.
Sure. And I resonate with a lot of what Ayushi shared. To put it simply, I feel like I've written like a novel or a book about myself throughout the course of this program. And that has been, for example, as Ayushi mentioned, there's the Mosaic project in the diversity and social justice class, where you're really looking at your cultural background and cultural experiences and aspects of your culture that have contributed to who you are and how you see the world. Before that class, in your first semester of first year, human development. You are writing about, there's like 4 parts throughout the semester where you reflect on your like early childhood. So like infancy, then like early childhood, then adolescence, and then sort of the young adulthood or adulthood, whatever sort of area you're in your life now. And you answer these different prompts related to each of those seasons to really reflect on, you know, where have you been in your life, and how did you become the way that you are? And so what I think assignments like that does is it creates a level of not only self-awareness, but also a level of empathy to recognize how complex we as humans are. And that serves when working with clients. You know, we talk about being able to conceptualize or understand the client in their full identity. I'm going to say that's actually much easier said than done, to actually really understand the details that may even seem small or insignificant, and recognize that, oh, that too plays a role in how this client is experiencing their mental health, experiencing the world, experiencing their challenges. You know, that really does take practice. And so I think going through the process of doing that reflection, and honestly, sometimes being challenged and to think deeper about who you are and what your beliefs are, particularly in the diversity and social justice class, I think ultimately has served us to be better therapists when being able to be empathetic with the clients that we're serving.
That's a really fascinating aspect of the self-reflection process that I don't hear too often, and yet is such an important element. Is it really helps level and calibrate for us as clinicians of really the sheer complexity of human nature. And, you know, we talked a little bit about this idea of unlearning sometimes, and how we have certain things by human nature. We're wired to be able to make rapid decisions and rapid conclusions based on information. That's just how our minds work, and which can work well in some instances. But when thinking of the complexity of the myriad of factors that led to a person experiencing depression, for example, it helps you slow down and realize that, okay, let's avoid some hasty conclusions and generalizations. There's a lot more information I need to know. So thank you for bringing that to light. All right, if there's no one else that would want to speak to that question, I'm going to open this up, and I'm not sure how many of you all are at the point where you're in your field experience. I know at least one of you is, and some of you aren't. But for those that are either in practicum or internship, would you mind sharing a little bit about that experience in terms of the type of work setting that you're in, what field experience entails, your supervision, and so on, and anything else that comes to light that stands out?
This is Jane. I can share. I think I really like this my internship experience. I can meet different kind of clients and explore the population I really interested in. For me, I can take my advantage of my own strengths and resources. For example, I work with lots of Asian American clients in my site, and the similar cultural backgrounds and experience did help a lot. And also, I think the schools, especially the school supervisors, provide a lot of useful suggestions for me to, as a beginners. I think at the very beginning, I have lots of cultural and language barriers here. And I also shared my concerns with my school supervisor and also my peers in my class. And they gave me a lot of support emotionally and professionally. So I feel like this process is a very, very valuable, because you can learn from your shortcomings and mistakes, and also you can learn from your peers and your supervisors.
Thank you, Chet. There are several things you had mentioned, it really stand out. Within practicum and internship, and this is really how it's designed to be, or how it should work out, is that it provides many different opportunities for you to take chances, for you to try something out and make mistakes in a safe, supportive environment where you get feedback, and there's minimal risk relative to once you're out there in the world on your own. So it sounds like you've received you've received support, but also meaningful feedback from your peers as well within that the group supervision environment.
Yes.
Great. I'm not sure if anyone else is in field experience yet. I know, well, yeah, but I'll just leave it there. I'll wait a few seconds to see if anyone else wants to speak to that.
Sure. I think you might be thinking perhaps of Ayushi and I. We are at the same place in the program. Both of us are going into practicum this spring semester, so like in a week. And so my experience so far with field experience has really been entering it. So finding a practicum site. As you may or may not be aware, students are responsible for finding their internship and practicum placements, which I think is a benefit and also can be a challenge, to be honest. So you do want to come in, thinking about what type of environment you want to practice your skills in. The program is helpful in that it provides us an extensive list of clinics and hospitals and just different placements, schools. I know school counseling is a little bit different. I'm on the clinical mental health counseling track, so I'll speak from that perspective. But they do provide a list, sort of an extensive Excel spreadsheet of different places that are, have a relationship with Hopkins that accept practicum and intern students. And what I would say is to, be proactive in looking for your placement. Transparently, this fell off my radar. And so I was one of the students who was looking for a placement even 2 weeks out from registration. And I want to say to that student, you're going to be okay. You're going to find a placement. But it does, make the process a lot less stressful to try to be proactive, even in just thinking about what type of environment you'd want to gain that experience, whether that's thinking about the clientele that you really want to work with, if that's thinking about the type of supervisor that you would want, or the type of setting you would want. If that's, private practice, I know I have an interest in private practice. And so my practicum is at a private practice here in Baltimore, or maybe you want to be more in a hospital setting or a community clinic, what have you. The school will provide you resources, again, like I said, with the Excel spreadsheet. Also, ask your faculty, ask your peers, make it a conversation to see where people might recommend, the cohort that's a little bit ahead of you, see sort of what they might say about different practicum sites. That has all been really helpful for me in sort of securing a spot. The process is a lot like an interview, like a job interview. I was actually told that the practicum site that I'm at was a little bit more extensive. So I had to sort of fill out a detailed survey about myself and sort of my counseling orientation and that sort of thing. But generally, you're going to have a call with somebody. They're going to ask you some questions, see if you're, a fit for one another, and go from there. So with that, I'd say my experience so far has been great. I'll keep you updated on how the practicum goes, but I'm looking forward to, getting in the field and getting some experience and practice under my belt.
I have not. Next school year, I'll be moving into practicum and internship. I'm attending the master's program part-time because, as I mentioned a few times, I'm still working full-time. So that is a possibility for those that are full-time workers. It's still possible to go to grad school as well. But as Nikki mentioned, school counseling is a little different. We apply with the coordinator at Hopkins. We fill out information. We can have our preferences as to what division, whether it be elementary, middle, or high school, and possibly what county. So Baltimore, Montgomery, Howard County, and based on the need is where you'll be placed. And so I believe that Darlene really tries to get people where they really want to be. But at the end of the day, it is where there's a need. So I've inquired about the process, but I actually won't be going through it. So in other words, we don't have to find our own placement like clinical mental health. But also we don't have the option to do it maybe over the summer because it has to be done in a school. And, schools are August through June or September through June. So same here, we'll keep you posted. I'm nervous, I'm excited. So some of the feelings you all might be feeling right now, inquiring about the whole program. Even though we've been in it, some of us are still experiencing those moving into a different level, so to speak.
Thank you. And yeah, both of you are just sharing, bringing to light the different processes for applying and placement between school counseling and clinical mental health. A large part of that is due to the school counseling being really led and run through the districts. So the school districts, so Darlene Conley, the field experience coordinator, I'm also as clinical director, work alongside her. But for school counseling students in particular, the districts in the schools, the district coordinators, they're the ones that really dictate that process the same way they would for teachers. And so a lot of those in terms of the final placements and assignments, while Darlene's a great advocate and really communicating with the district coordinators, at the end of the day, they're the ones who dictate the process and what they need and what's available and when. So thank you for bringing to light those notable differences that occur. And I know that there's time set for Q&A. I'm wondering, if any of y'all would give any just parting advice, what general advice would you have for prospective students that are interested in applying to the program here at Johns Hopkins? And, Nikki had already kicked it off in giving some sound advice with regard to a field experience. Any general advice you would give to the audience?
I would say just do it. And I wrote that in my notes, literally. It was a lot of, again, for me coming back into school after so many years, I was nervous, things have changed, there's online, everyone's gonna be younger than me, looking at me crazy in the classroom, but it's not like that at all. Everyone is welcoming, and we spoke a lot about diversity before, international students, diversity of race, religion, gender, but there's also a diversity of age. So there's literally all types of people in the classroom, parents, people who work full time, maybe some who have just graduated from undergrad. So you really will find your place, and it's very welcoming. And also, even being a native of Baltimore, just the name Johns Hopkins University is very intimidating, but we all belong. And so I don't think that should deter you from applying or seeking out the program if you're interested. And then again, the professors are super helpful, understanding, and caring. So just know that no matter the prestigious name, which is great, and we all love it, it really is a welcoming environment. And once you get in the doors, it doesn't feel like that. It feels, feels like home.
Yeah, piggybacking off of that, that was really beautifully said. I agree. When you come in as a master's student, at least for me, initially you might feel a little alone, a little isolated, but you do find your place and you do find your role in this environment that is very supportive, which is a very warm and welcoming learning space. So knowing that you will find your space and you will be able to seek the support that you need, and you will have your friends around you and peers um, who help you in that process of growth was really helpful for me to know. And even now I feel like I have been able to sort of find my place in this learning environment, and and as just a social support system. So that way, I think you have to take that leap of faith, like Aisha mentioned.
I have a couple points that I'll highlight. I wanted to say this a little bit earlier and make sure I said it before we close, but coming into grad school, you want to be prepared to advocate for yourself. And that's, there's a degree of that in undergrad for sure, but in grad school, like Aisha said, just do it. You got to go get it. Your advisors, your faculty, they're all here to help you, and they are incredibly supportive, but it's not, you're going to get the most out of that when you are seeking that advising, when you are seeking that support, when you're saying, hey, this is a type of experience or diagnoses or what have you that I want to focus on. Do you have any resources that you think I should explore? Or I know I had an early conversation with my advisor to talk about, I don't know sort of what I want to do after this. I know I want to pursue a doctorate, but in which path? Can you talk to me a little bit about what the difference is between counseling psychology and counseling and supervision and education, which is the doctoral degree aligned with this field. So people are really here to help you. You just want to be prepared to go get the support that you need. Even with the mentorship program that we have here at Hopkins, being able to go and tell your mentor, this is what I need help with. Can you tell me what this class is like? Is it too much for me to schedule these 2 classes back to back? Whatever it is, be prepared to come in with sort of a proactive stance to go get the type of education you're looking for, and frankly, that you're investing in, that you're paying for. The other thing that I would say is, I think a big part of the value in my experience has been my peers. Being able to sort of find your people, whatever that looks like, whatever that means to you, finding people who are going to support you in the journey is what makes it feasible to get through. Honestly, the assignments are challenging, but it's the type of challenge that you want. And so being able to, have a peer who you can text and ask, can you remind me what the professor said about this aspect of the assignment? Or like, did you hear that the same way I heard that? That has been really incredibly necessary for my academic journey. And so that's something that you want to be open to coming in, is being open to finding your community, establishing your community, so that you do sort of find your place throughout the program. And then the last thing I want to say is, if you are overwhelmed with the process of applying to grad school, we've all been there, done that. And so I just want to send you some encouragement. Don't be discouraged if your personal statement requires multiple edits. I have been told I'm a strong writer all my life, and I had multiple edits of my personal statement that took me several months to go from start to finish. And so I know the process can be daunting, especially when you are applying to multiple programs and you're sifting through all this information and you're trying to present yourself in this best light. But I do just want to encourage all of you who are in that boat and just feeling a little overwhelmed, or, questioning if you even belong in grad school or belong at Hopkins. There is a place for you. Put your best self forward, and you'll be okay. It'll get done. And I wish you all the best.
Thanks, Nikki. I feel like this is a very, very valuable points and suggestions, but I don't have much to say because you just share very good suggestions. But from my perspective, I feel like maybe some of you may have no idea about like what counseling really looks like and if it really fits for you, but just to be open and take a curiosity attitude to make explorations and be prepared for any like potential challenges or kind of adventures in the future kind of practice. But I think you will love these programs and you will love this counseling area because it's a really amazing journey. Thank you.
Thank you all. Thank you again, panel members. Greatly appreciate you all being here and imparting your wisdom and experience.
Thank you for having us.
Thank you.
All right, so moving on to Q&A, and thank you again to the panelists for being here and providing such a great insight on your experience here at the Johns Hopkins School of Education. And of course, thank you so much, Dr. Lauka, for facilitating this student panel. And I know that we don't have that much time, so I'm going to quickly go through some questions we received. We received a question, this is actually for Aisha. Is it hard to work full time and attend the program?
It has its moments. Honestly, it does have its moments. I'm not exactly sure where you work, but definitely communicate with your supervisor or your boss on the hours. I choose classes that usually start at 4:15, but I think there's some that also start around 7. So there are some options. But yes, there are times when it's hard. And I was listening to another panelist speak, and I would also just add, just have your circle around you that's constantly supporting you and uplifting you. And then there's also other people in the program who are working full time who can who you can relate with, and you'll find them pretty quickly. So it has its moments. There's some sacrifices. A lot of times during the semester, my weekends are pretty much dedicated to work, but you just kind of have to always keep the end goal in mind. And sometimes the tunnel will be pitch black and you don't see the light at the end of the tunnel. But it's there. And every semester when you get to a new course and it's exciting and engaging and interesting, it kind of lights that fire. So it's a challenge, but it's worth it.
Thank you, Aisha. The next question we have is, do students learn the skills of counseling by working with one another, practicing the role of therapist? Do you do any type of experiential exercises before the practicum or direct clinical experience?
I can answer that question. It goes back to how we discuss about these mock counseling sessions that we have, and a lot of group work with peers where we're acting as mock counselors. I think that was incredibly valuable before, and makes me feel like I am prepared to a certain extent before entering practicum and field experience, because I was able to practice all these counseling techniques and all these different skills within a safe space where feedback and constructive criticism was appreciated. So being able to do that first in a safe space where you're doing it around familiar people and you're learning and there is space to make, there is room for mistakes. I think that was very helpful for me because I could really hone my skills in that context. And now knowing that I do have those skills and knowledge and I can apply it in a professional setting makes me feel at least a little bit more prepared. So yeah, I do think the program prepares you with those skills where you're practicing with your peers and you're getting feedback from your faculty members.
Thank you. The next question we have is, for practicum and internships, are students limited to Baltimore area locations, or are Washington, D.C. area locations available as well? And Dr. Lauka, if you want to answer that question.
Sure. So we do have a broader catchment area of partnerships. We do have some in the DC area, and we've even gone as far as, well, with only about one or so in North Carolina, but we broaden out to the DMV area in general. And so we have, I think, about close to 100 official affiliations with community mental health agencies all throughout that DMV catchment area, which does include DC. Yeah.
Okay, so we'll ask another question or two and then wrap it up. I know there's several in the chat. You all have talked a lot about diversity, especially regarding race, ethnicity, etc. How is diversity in gender, sexuality, disability found in classes and within peers/faculty?
This is Aisha. It is, that's definitely talked about. There's a lot of times, and maybe almost all of our classes, where we get case studies. and every case study is different, and gender and sexuality is included in that. I just last semester took ethics and a CBT class with Dr. Lauka. But definitely in our ethics class, we talk a lot about gender and sexuality and kind of what that looks like. But we did kind of talk more about the race and things like that. But we also gender and sexuality and disability is included in that. I personally, to my knowledge, and I'll say that because I don't want to assume anybody's identity, haven't encountered a classmate with maybe a physical disability. But again, as I said, to my knowledge, but I believe that the buildings are accessible and things like that.
And I'll quickly add to that. So I think a benefit of the program and the way the assignments are outlined is that there are a number of assignments where you essentially get to decide sort of what identity, demographic, or experience you want to focus on. So for example, in my diversity and social justice class, we had to do a presentation on intersectional identities of a prospective client that we might want to work with. And so I chose to do my presentation on Black transgender women. And, you know, various classmates, some other classmates did transgender clients, other classmates did various like racial or ethnic demographics. Others did clients with disability, what have you. And so I say that to say there is space for you to research and focus on the specific sort of demographic or identity or experience that you have interest in serving, or that you simply want to explore and learn more about. So yes, there is the component of professors and the curriculum covering all of the many different areas of diversity, which you will get a lot of. I think there is a lot of variability, even outside of race and ethnicity, again, with the case studies that Aisha mentioned. But there is also room for you, if you have like a specific demographic or experience that you want to focus on, there is room for you to sort of create your assignments. There's a number of assignments where you get to design the client that you are ultimately going to sort of conceptualize and treat. And so that's sort of an opportunity for you to really, you know, get the experience and the learning that might be of most interest to you.
Okay, thank you. And for sake of time, the final question: does a diverse work experience help within psychology and counseling, or are grades an important factor in getting an acceptance from JHU?
So with our admissions decisions, we really take a holistic process. We require multiple pieces of information. And certainly we have a threshold in terms of what we look for in an academic record, but that's only one part of it. You know, as I think Nikki had mentioned, there's a personal essay, personal statement. There's also looking at your background and the type of work and type of spaces you've been involved in, and really what we look at. It's not necessarily just what work experience. You don't have to have worked for 10 years in a clinical setting, for example. What types of aspects are you volunteering in? Where do you devote your time and energy, and how does that align with the mission and the program objectives? Those are the types of elements that we're looking for.
Thank you so much, Dr. Lauka. So this concludes our student panel for this afternoon. Again, thank you guys so much, the attendees, along with the panelists, and also Dr. Lauka. We really appreciate your time. I feel like this was great information. This session is recorded, and so it will be available via email in the next week or so. If there are any other questions that were unfortunately unanswered, please see my contact information here on the screen. You can certainly email me directly, and I will follow up with your questions. Thank you so much, and you all enjoy the rest of your day.